Hi, I'm Tana Senn, your state representative from the 41st. So many issues that plague our communities have enormous impacts on our adult population, and often even more complex ones for our youth. Today, I'd like to discuss three of them: homelessness, mental health, and toxic exposure. Speaking as both a legislator and as a parent, youth homelessness is a tragedy that we simply cannot ignore. The opportunity to thrive starts with a safe place to call home. Just think of the struggles faced by homeless adults. Now add to that the challenges of a high school, middle school, or grade school student who is expected to perform in the classroom when he or she is missing the safety and security of a home or a warm, safe place to do their homework. For more than 30,000 Washington students, this is their reality. Of these, an estimated 2,500 are unaccompanied, meaning they are not in the care of any parent or guardian. This means they don't have anyone to take them to, let alone give them permission for, a well-cared doctor visit. And these numbers don't even include very young children who are not yet school-aged or young people who have dropped out of school. Boosting the presence of homeless liaisons and mental health workers in our schools will help identify and support homeless youth. Until every child has a safe place to call home, addressing youth homelessness will remain a priority. Did you know that an estimated 20% of children have a mental health issue, but less than 1% of these children are receiving services? Something is very wrong with this picture. We recently approved Representative Kagi's House Bill 2439, which would increase access to mental health services for kids. The bill will help identify and remove the barriers to access for children's mental health services to make sure kids get the help they need. Additionally, the bill would require medical assistance programs to provide payment for depression screens for youth ages 11 through 21, as recommended by the American Academy of Pediatrics. With suicide being the second leading cause of death among 10 to 24-year-olds in Washington state, these screens will save countless lives. The sooner we can get kids connected to available mental health services, whether it is to address a trauma, a chemical imbalance, severe anxiety, or depression, the sooner we can improve health and education outcomes. I don't know about you, but I hate shopping for pajamas for my kids. Whenever I see the label that says flame resistant, I get a bit anxious. Of course, I want to keep my kids safe from fire, but are the toxic chemicals used in these products dangerous? The Toxic Free Kids and Families Act, House Bill 2545, would restrict the use of toxic flame retardant chemicals. These chemicals, with names only pronounceable by a trained chemist, are often, unbelievably, found in everyday items like furniture, car seats, and toys. Of course, very young children often put things into their mouths, and they end up ingesting these toxic chemicals, which can lead to cancer, hormone disruption, neurobehavioral disabilities, ADD, learning and memory deficits, lower IQs, and even infertility. While this issue is not nearly as pervasive of a problem as the lead poisoning caused by Flint, Michigan's water supply, it is certainly a critical opportunity for us to help keep our kids safe. Again, it's such an honor to be your representative. Thanks so much for watching.